Welcome back to the teleconferencing session on the healthcare waste management. We come to the second session, and in the second session, as we mentioned and discussed, that we will request Dr. Megha Rathi to talk on the very basic things which are there in your course 1, that is the environment pollutants and the waste, the solid waste in general, the waste management in general. So before I request Dr. Megha, another reminder that we are not getting any questions from any regional center. So if there are any students viewing this, you are requested to please at least tell us that you are there, you are watching us. Even if you don't have questions, please let us know, and I will request the studio to scroll the numbers, the toll-free numbers and the other telephone lines. And yeah, they are already there. You can see on the screen. You please use these phone numbers, call us back, send the facts, anything, email, etc. But best would be to pick up the phone so that we can have the live interaction discussion, because we have Alex with us, which is not so common to have him. He's so busy traveling all over the world actually. So working, yeah, of course. When I say traveling, traveling doesn't mean that you are having holidays, Alex. Yeah, it means that you're working very hard. Yeah, in the office also. So you must make use of this opportunity during his presence when especially is here. So over to you, Dr. Megha, to make a presentation on the environment pollutants. And thank you.
I welcome you all again to the second session. As Dr. Agarwal has mentioned, I'll be taking something really simple which is there in your course 1, which is understanding the environment, the block 1. Precisely we go to the block. Here we've discussed about the environment and the basics of waste management. So we just take the same thing here. The first topic that I'll take up is environmental pollutants. Environment, as all of us know, is our surroundings, the sky, the water we drink, and all our immediate surroundings makes the environment. So with the industrialization, the environment was gradually getting a little disturbed, and then the pollutants came in, wherein we have had problems with the pollutants which are affecting us. So just defining pollutants in a very simple way: any substance present above a certain concentration threshold in the atmosphere, soil or water, and poses a direct or indirect threat to the well-being of human population, that's a pollutant. So now we see there are different kind of pollutants that we encounter in our day-to-day life. These pollutants lead to a concept called pollution. This any undesirable change in the physical, chemical or biological characteristics of our environmental component, that is air, water and soil, that adversely affects various life forms and life support systems in the biosphere. So this is the pollution. So now and the waste management that we've talked in the course is a part of this. Healthcare waste management is also a part of this, and I'll briefly talk upon the different aspects of environmental pollution other than the solid waste management I'll take later on. Air pollution, water pollution, noise pollution and radiation pollution. And just now I was being told by Alex there's an indoor air pollution that we've really been talking about nowadays. So I'll request Alex if we can just talk something on the indoor air pollution also with them. Air pollution per se is the pollution that is there in the air, and there are different kinds of air pollutants that we encounter. The air pollutants can be basically divided into primary air pollutants and the secondary air pollutants. The primary air pollutants are those which are produced directly by the activities that the human beings, they're generated directly by the activities by the human beings do, like the oxides of carbon, that's carbon dioxide and carbon monoxide. These are these are different categories. As I said, carbon dioxide and carbon monoxide, they are one of the major air pollutants, both indoor and outdoor. We have a lot of them. They are produced by the combustion of coal, oil and other fuel and energy productions, and also the manufacturing of transport, the vehicular pollutions. All of them lead to the oxides of carbon, and similarly the oxides of sulfur. The basic forms here are the sulfur dioxide and the sulfur dioxide, which further, when reacts with the atmosphere, the airs which are there, the oxygen in the atmosphere, to produce sulfur trioxide, which further reacts with water. We have sulfuric acid being formed. So these are the different oxides of sulfur, and you must have heard about the acid rains, which of course one of the major reasons here is the sulfur, and this sulfur is emitted from the smeltings, the fuels again, the petroleum extraction, the refinery, paper mills. All of them are the major sources of oxides of sulfur. And then we come to the oxides of nitrogen. These again basic here are nitric oxide, nitric dioxide. These are the basic forms, and then which are produced again by the use of petrol and diesel, and for transportation vehicles, burning of coal. All of these, and biomass burning. Also one of the major sources here are the fertilizers and the pesticides, which contribute a lot here. And then the gaseous hydrocarbons. This is another category of the air pollutants. Here we have the benzenes, the methanes and things like that, the basic hydrocarbons that are emitted into the atmosphere. Photochemical oxidants, these are basically the oxidants like the ozone, hydrogen peroxides. These are produced as a byproduct of secondary pollutants into the atmosphere, and the chlorofluorocarbons that we produce by basically the refrigeration and the cooling processes. All of you must have heard that they are destroying the ozone layer. So this is another very important category here, which has been talked about over and over again. And the suspended particulate matter, this is basically from the vehicular pollution. Here, depending on the size of the pollutants, the suspended matters, they have been divided into heavy and light. And then the heavy metals. The heavy metals, basically the two which really bother us most are the lead and mercury. Mercury has already been touched upon by Alex, and I'll take it down further again. So these are not, as I said, they are different sources of air pollutants. And when we talk about healthcare waste management and the hospital waste, we see that the hospitals also contribute a lot to especially the heavy metals here and the hydrocarbons there. So these are the two main areas. And then this is a small, can we have the slide please? This is a very small, this is a slide from within your book actually, so to just make it more familiar to you. How we encounter air pollution, what are the different sources of air pollution, and what are the primary sources, and how are they converted into the secondary sources. The next slide. Here now we talk about the mercury pollution. We've been talking a lot on mercury, as it is one of the, as hospitals and the various other healthcare facilities generate mercury as waste, like the thermometers you use, the blood pressure machines, all of them contribute to the waste, mercury as a waste to the atmosphere. Now it's very important for us to know how do we manage the mercury. As Alex has said, it is important because the hazards of mercury are very well known to all of us. Now it's important how do we contain this within the hospital so that it's not being disposed of either into your sewage lines or it doesn't go to the atmosphere. So it's important to contain this mercury within the healthcare facilities. For this, there are different guidelines that have been provided in the healthcare facilities, and even when you go through your course program, you'll find in the same block 3 of course 1 has a lot on mercury. So once you go through this, you'll find how to manage mercury. It's especially the very simple step. One thing that we need to remember is never handle mercury barehandedly. We should always wear a pair of gloves, so that, and mask maybe, so that we don't inhale mercury, and we contain mercury in a bottle which has some water in it, because mercury being heavier to water would just be there, and then send it back to your stores, who can just send it back to the manufacturers. And at the hospital level, the administrators can take note of substituting the products, mercury to non-mercury products. Now they're very well available, and there are certain hospitals who are moving out of mercury now. So, and this dioxin, I said this is another category of air pollution that is produced within from the hospitals. Not only the hospitals, as you see, there are different sources of dioxins, and there are different sources that contribute to dioxins. There are dioxins and furans here, and how they enter air, water and soil. The different routes how they enter, and finally they just get into our bodies. So we have to make sure that while even though if we have incinerations in the hospitals, we need to be sure that we do not burn chlorinated biphenyl, especially the PVCs and the chlorine containing plastics. They don't enter into the incinerators, as they are the major sources of dioxins. And then here again, I think so we should just substitute it to non-PVC products. And then if you have any questions, you can just come up with them. Water pollution, this is the next major pollution after air pollution. All of them are equally bad. Water pollution, the different agents that cause water pollution, biological agents. We are aware of the different diseases and the infections, epidemics that are caused because of the bacteria and viruses that are found within the water, and cholera being one of the most common one here. Then virus, bacteria, protozoans and worms that are present in the water, they contribute to the biological agents of the water pollution. And the chemicals also contribute. There's inorganic agents, organic agents, and the radioactive substances. We have physical agents like suspended solids and heat. So starting from heat we mentioned here just because, especially when we have thermal plants and all within where in the water you have a lot of heat that's been generated, which spoils the ecosystem, the environment of the water. So it's one of the major sources of water pollution here. Suspended solids is the solid particles, the sand particles that start accumulating in the water, a lot of them, and which results in floods and all. And the inorganic, then coming back to the chemicals here, chemicals you can divide into inorganic agents and the organic agents. Inorganic agents would be the phosphates, rather all the chemicals that have been generated, especially from the industries, which lead to water pollution. Organic is again you have all the animal refuse and all coming in here. So, and radioactive substances, they again being thrown down in the water. So water pollution, I think so it's very important to contain it when even within the hospital. As we were talking about, in hospitals there are hardly any precautions that you're taking in terms of managing liquid waste. So it's very important that the hospitals not only try to manage the solid waste very well, but also the liquid waste that's coming out, so that they are not leading much on the water pollution here. So this is on the water pollution. And then we have on noise pollution.
Megha, they have a question from the audience in the studio. Can we have the question from the audience, please? Yeah, just a minute, let them organize the camera also. Yes.
I have one question.
Can you speak little loudly?
I have one question in my mind. As you told about liquid waste management, how will you channelize differently or segregate the liquid waste coming out of different units in a hospital before it is treated and finally disposed of?
From within different units
Yes,
of the hospital.
because all the liquid waste are mixed up, and how will you treat? You cannot treat the whole waste, but you can treat it, you can channelize, and then it is treated, then mixed with the general waste.
Probably the question is asking that the liquid waste from some units like blood banks, laboratory is more dangerous than from the kitchen or from the general ward, so this point is probably that is there a way by which we can segregate the more infectious liquid waste from certain potentially dangerous hazardous areas, or all the liquid waste has to be taken to the effluent treatment plant? Alex, any think Megha.
Here, yeah, I think so. One way is within the hospitals, especially when they're designing the hospitals, they can have different septic tanks within, smaller units in the hospital, where they have, especially where the blood is going, they can have a special unit where they have to use disinfectant separately to be poured on there, and then they can discard it into the general waste, general liquid stream of the hospital.
This is important.
Yeah.
What Dr. Megha has said, that from the laboratory or blood bank, first of all, the liquid waste which is there, which which the laboratory personnel technicians know that it is hazardous, that must be decontaminated by chemicals within the department, and then it can be let off into the drain, because then ultimately it will be taken care of in the liquid waste treatment plant, effluent treatment plants. So the most important thing is that there is no need for separate drainage system for laboratory, for blood bank, for operation theatres, but the point which is important is that the liquid waste which is potentially hazardous must be decontaminated, and then it should be discharged into the sewerage, into the drainage system, so that it can be taken care, isn't it?
Yeah.
So that its impact is safer if it is disposed in a general waste, in a general liquid waste.
Yeah. Common waste stream.
Yeah, maybe just another point to that one. Most water treatment plants function by biological decomposition. Now, if those waters are loaded with too much of chemicals, these chemicals maybe will kill those bacteria that we need to take over the biological load that we want them to treat for us.
Correct.
So that takes us to another one, that is, let us see how much less chemicals we can use within the healthcare waste, the healthcare facility.
Right.
Like for cleaning,
Yes,
for disinfecting,
yes.
maybe we can do with less chemical load in that liquid waste.
I think this is very, very important. Alex, you have made a very important point which I always share with my students when I teach hospital administration and the cleaning practices in the operation theatres, in the wards. There are large amount of chemicals, like we are very fond of using phenyl, or some phenyl derivatives, deodorants in the toilets, or for cleaning the floors, some other chemicals. There is no need for any chemical, because most of these chemicals, once they are used for cleaning the floors and all that, they are so much diluted that they are not capable of killing any microorganisms, and especially the hospital microorganisms, which are very resistant to very hardy and very resistant. So the best practice for cleaning is simple soap and water. So copious amount, plenty of water cleaning. All you have to do, you see how the hospital infection is generated. It is that either we have to either reduce the volume and the number of the microorganisms, or reduce their virulence. Very little we can do to reduce the virulence of the microorganisms, but certainly we can reduce the number and the volume of the microbes by thorough cleaning with simple water and some detergent, and that should be good enough even for the operation theatre. That should be good enough for simple ward. So, and once you use simple water and simple detergent for cleaning and washing the floors, including the operation theatres, there is no need for using the chemicals, and that's how we can reduce the chemical use in the hospital, save a lot of money. And then the problem of killing the microbes which are helping in the effluent treatment plants. So that's very important. Thank you very much. Any other question from the audience? Yes, okay. Yes, we have a lady to ask a question, please.
Sir, as you've mentioned that there are...
Can you identify yourself?
I'm Neelam here.
Okay.
Sir, as you said that there are different kinds of bags used in the hospital situations.
Color bags.
Colored bags.
Okay.
So where do we dispose of paper waste which is contaminated with blood or body fluids?
Okay, I mean this is simple. This becomes a, if the papers are contaminated, anything which is contaminated with blood or pus or body fluids becomes hazardous. So it comes in that 15% category. So it has to be taken care of, and since the paper can be either burnt, we can send it to incinerator or
Autoclaved also.
autoclaved also, you know. So you can do that. Autoclaving can be done, and then it can be sent for the deep burial and the sanitary landfilling. Isn't it, Alex? Anything else you want to say here? So if the paper is mixed with the blood, etc., we can take care in this manner. Isn't it?
Yeah.
Yeah.
Anything that is contaminated with blood is infectious.
Yeah.
So we have to treat it as infectious waste.
So it can be put up with the soiled waste itself.
Yeah, it has to be put up with.
It has to be put up with the
put
soil
up.
waste. Yes, it cannot. It's no
It
longer a
can-
non-hazardous 85%.
Yeah.
It becomes hazardous 15%.
Thank you.
Hmm. Thank you. Yes, Megha,
Yeah,
please.
before I go, I thought,
Yeah.
Alex, if you could talk on indoor air pollution, controlling it within the hospitals.
Good. Indoor air pollution. These days you must be hearing a lot in newspapers. And indoor air pollution, I think Alex, being the environmental health advisor in the Southeast Asia Regional Office, is working very deeply into this. Maybe you can throw some light on the indoor. This is just for your information, knowledge, etc.
No, it is not such a complicated matter. It's actually common sense. And that is that when you live in a closed environment and you stay there for a long time, whatever is in that environment has much better chances to impact on your health than if you were outside. Now, air is around you inside the house, inside around you in the workplace. You work in a health facility, and all these pollutants that she has mentioned, Megha, will not always be there. But it is a little frightening to see that if we are not aware of this, we may be doing nothing about the fact that a health care facility is becoming a place where you get sick and not a place where you get well.
Yeah.
So there's something wrong there. So it is important that we are aware of the potential hazards that are there, and especially those toxic chemicals that can be present in the air that we are breathing. It is not a question only for us who work in the hospital, it is also for the patients. Patients come to a hospital, they should get well. They should not go out with some respiratory infection. So it is also our responsibility to make sure. It is the concept of patient safety.
Yeah.
So these days we are talking a lot about indoor air pollution that is related now to what is happening in the kitchens in the rural areas, where women are there for many hours cooking, exposed to the smoke from the burning the cow dung and the firewood. Babies maybe on the back somewhere, small child also hanging around. All these people are extremely exposed. And from those studies that have been carried out, we have seen that a particle that is there in the air inside the house compared to outside has 1,000 more chances to penetrate deep into your lungs. So there is a huge difference between your exposure outside to ambient air pollution and if you are working in a place where you are exposed to some pollutants that you're maybe not aware. Good example, mercury. Good example, mercury. We, maybe Megha can also relate. I heard about the case where they were completely unaware, and by chance, I don't know how it happened, they started measuring this one. They found a lot of mercury in the air. What was it? The soil was a wooden soil, and the mercury had gone through the
Okay.
planks,
Yes.
Yeah.
and they found a lot of mercury there from the several years of broken thermometers had just gone through the wood, and it was
Evaporate.
evaporating there. So these are important elements for you all to understand.
Thank you, Alex. Thank you. So you see, the point which came up during the discussions about the mercury that he has mentioned, the other things about the effluent treatment plant that we were talking. And then Megha, another point, then you in the indoor air pollution. So I think this has been clarified to a large extent. Megha, you may please continue with your presentation.
Thanks, Alex. So as we just coming back to the presentation, we were talking about water pollution, and then now the next kind of pollution that we come across is noise pollution. Noise is anything that is distressful to our ears, is noise, and which is basically a pollution. And there are different sources of noise pollution: traffic, aircrafts, construction waste, and industry. You can broadly, they're the sources of noise pollution. And we day-to-day encounter with the traffic, construction work, aircrafts, construction, especially construction work would affect the construction workers who are there. And I think so this has to be also be taken care within the hospitals. If you have a new building or something coming up, so you need to make sure that the patients are not suffering because of this. And then industries in itself are major sources of noise pollution. So we can actually help the patients with having certain walls which are noise, they're free, the sound free, the soundproof walls. And then the other kinds of pollution, that the pollutants basically that we talk of is the greenhouse gases, acid rain, deforestation, ozone holes, and global warming. Can I have the next slide, please? Yeah. So greenhouse gases, basically a greenhouse was a concept which is used in the countries where the winters were too harsh and too bad and the plants could not survive. So a glass house was made wherein different concentrations of different gases were such that they were good for the plants then. But then this concept is not only restricted to the greenhouse, but it's just expanded over and it's there everywhere. And wherein the gases, especially carbon dioxide and the carbon monoxide, they are the major culprits here. And you can see the small picture there also that shows on, especially on the greenhouse gases, reflected the short wavelengths that come from the sun, and they are supposed to go back out of the atmosphere, which are not able to go back. They are not reflected back, but stay within the atmosphere of the earth and increase the temperature. And the acid rains that I just shortly touched upon was when the rains get a little less than 5 pH or something. When the rains are less than that, with the pH or waters with a pH of less than that, is an acid rain, wherein basically sulfuric acid and nitric acid, they are formed in the atmosphere as secondary air pollutants, and they mix in with and rain in the form of rain. They affect us. And deforestation itself. Yeah, deforestation is a major concern, because earlier we had lots of plants where the carbon dioxide was absorbed by them and whole green stretch. Now the deforestation, everything is just going on, and all these hazardous gases are not hazardous, but the concentration of these gases are increasing more and more into the atmosphere. So I think so we should just propagate on having more plants and more trees everywhere, in the hospitals, around the hospitals, in our cities, everywhere. And ozone holes, as we had mentioned briefly, was on the CFC, the chlorofluorocarbons. They are the major culprits here, where ozone, which is a protector of the the earth, there is a big hole that's been created in there because of the release of the CFCs. They have a chemical reaction with ozone where it changes from O3, it just converts into O2. And then all this leads to global warming itself. So this was on the briefly just touched upon the environmental pollutants, and now coming back to waste management, though we've already talked about a lot in the earlier discussions, just talking generally about waste management, why not only the hospitals but other than hospitals also we need to manage waste. And that's the concepts remain the same as they are in the hospital. The concepts of waste management always remain the same. Segregation at source is the key to any waste management system. Just the slide, can I have the slide please? Waste categories. There are different waste categories, general waste categories. The hospital waste management has already been talked about. This is the general waste categories that all of us encounter at our and the garbage, which is something garbage, rubbish, ashes. This is again the word that this is exactly what I've taken up from your modules here they use. It's garbage would be basically a little organic in nature. Rubbish is here all the things that can go in for recycling, and ashes. You have a lot of fly ash. Consider it as a major category here is the fly ash that's been generated from the power plants. Then large waste, especially for the construction waste that is there. Dead animals, sewage, we've already talked about. This is a liquid waste, and the human excreta. They made the major categories, waste categories, and the major sources of the waste are municipal waste. The municipalities, they collect all the waste and they just dump it. Maybe if they have a proper municipal landfill, they use it. Otherwise, they just dump it anywhere. So it's municipal waste is the waste that's coming out from there, and the domestic waste, all of us generate it. Again, here it's just been put off. Either we mix all the waste together and we just throw it away into the municipal dumps if we have proper municipal dumps, or just outside our homes. And the commercial other you have all the malls and things like that coming up, the shopping areas. And the industrial waste, industry is a different category where we have all the liquid waste also, and the solid waste, everything that's coming up. And if it's untreated, it's really a major problem for us. Mining, we have a lot of mining activities where to extract really valuable things we spoil the environment and the ecosystem. A lot of waste that's been generated from there, it just lies there hanging. It spoils the ecosystem there, and the people who live there have problems of drinking water and a lot of diseases. Agriculture waste, especially the animal waste, and you have the soil crops and things like that here. And the hospital waste itself, as Alex said, it's on the Basel Convention, treat hospital waste as the most dangerous category of waste amongst all these waste that I've talked about. And the principle of waste management remains, they just remain the same. Segregation is the key to any waste management. Whether it's our home or the hospitals, we need to take care that we segregate the waste at source where it has been generated. So within our homes, we might just have the waste that's been generated in the kitchens, that is more organic in nature. The vegetable peels and the fruit peels and all go separately. They can be used. You can have small organic pits, where you could have generate your own manure for your little plants that are there, and then segregating it with the waste that can be recycled. You send it to the kabadi walas. We already have this tradition of segregating waste, especially in all our homes. At least nothing but the newspapers go off separately. So we can have similarly all different kinds of plastics, the papers and everything go separately rather than mixing it with the organic waste. Then comes the collection and storage. So we need, once we have proper containers to collect and store the waste, then where the segregated waste is collected properly, and then we go to the transportation waste, transporting the waste. Here within the cities, municipalities play a very major role. So I guess as we were talking about, it's important to also train them not only on these areas of transportation, and also the households, where though we all have this act, the Municipal Waste Act already exists in India, but I don't think so many of us are aware of this rule that's there, which categorically says that we need to segregate waste within our homes, and then properly they need to be collected and transported to the municipal dumps where they need to be treated accordingly as per the categories of the waste. So I think so it's important that this awareness is being generated amongst all of us here. Transportation, and then finally the treatment and disposal. This as already has been touched upon is like, we have different treatment options and disposal options available for treating waste. And maybe when I said the household organic waste, you can have just composting it while recycling the other recyclable waste. And then you could, it's not an option, but yeah, we could have biogas generation. I think so Alex will be one of the options there, and then the incineration.
Yes.
Can we have the mic for them, please?
Okay, your mic is there. Yes.
As we have seen,
The patients who are not identified as a patient and at home cannot be checked. But when the patients are discharged from hospitals and they take some sharps and some part of the treatment at home, their waste is not disposed of separately, and they are not trained to. They are not aware of that. They should dispose all the portions of that soiled or something related to blood and needles, sharps. They are not kept separately. It is mixed with the domestic waste and disposed of. So it is a common practice with all of us. So how can we check this?
Okay,
Difficult one.
little technical. Yeah. Normally, there are not too many injectables that we ask the patient to take at home, accepting
Diabetic
the
patients, I think.
diabetic patients. They know they have been taught, because they use the same needle on themselves, and the needles are sterilized also, and they should be decontaminated. So that much of education. But normally the injectables are not used at home, but there are some instances where the somebody is coming to give the injections. Either the doctor or the nurse has been called to the house for giving the injections for a couple of days following the discharge. In that case, we need to give the health education to the patient, and also the doctors and nurses. Sometimes we are the culprits. The doctors and nurses are the most difficult people to tackle with in the hospitals, because they are not careful about disposing of the sharps particularly, and as you said, the probably soiled swabs or dressings. So with regard to the sharps, certainly I think we have to be careful, and probably if there are any sharps which are generated at home, they should not be discarded into the domestic waste. We'll have to take care that either they are deep buried, or we collect it in a box puncture proof container and send it back to the healthcare facility which is nearby. And with regard to the swabs and all that, best thing would be to put them in a for decontamination in sodium hypochlorite solution or in some alcoholic solution, and then make it safe for throwing it in a domestic bin actually for disposal. Isn't it, Alex? Anything more than that?
No, definitely what Ashok was mentioning. Let us start at home. Let us do it right at home. That is, at the hospital, at the PHC level. If our staff understands this, and it takes time, but it happens. We have seen it happen. Those staff will also try to educate those patients that you mentioned here. On the other hand, yes, there are many injections that are given without being needed. It is patients sometimes would like to get a shot. If the doctor didn't give the shot, maybe it's not such a good doctor. Something there is some need for awareness. I'd like to mention, that the very big immunization campaigns now are using a lot of disabled syringes. They are only working one time and then they're discarded. The big donors behind these huge campaigns have understood that while they are doing very well in immunizing children, helping immunize children, they should also do it in a way that it will not pose any kind of risk to human health or environment. And as we are talking now, we are getting a lot of support from the Global Alliance for Vaccination to see that those sharps waste that are generated during such campaigns is taken care of properly. And in India, it is now seeing the light. We are having very interesting schemes at each one primary health center. I think there are about 33,000, something like that.
Yeah.
Now being set up in order to make sure that the sharps are handled in the correct manner. That is, immediately as the sharp becomes waste, that is the moment the needle leaves the human body, it is cut off. The needle is cut off the syringe. Then both are treated chemically, a needle goes into a shop spit, specific shop spit only. Plastic then recycled, if possible. So this needs quite a lot of organization. But what I want to say is we need to do it first ourselves and show it is possible, and then others will follow. People will only actually believe you by example. I think so.
Thank you, Megha. You may just
I think so,
conclude.
yeah, it's true. Yeah, it's true.
Okay.
Yeah.
Okay, then I
That
think
is
I would
very-
like to thank Mr. Alexander von Hildebrand and Dr. Megha Rathi for being with us, for giving very excellent presentation on their subjects, and I'm sure that the viewers, at least in the studio, have been benefited. But it's pity that we did not have questions from the regional centers, and though the intimation has been sent to all the study centers, but if you are not coming for the teleconferencing, I think you have missed a lot. Anyhow, we are recording, we have already recorded this, and we will try to send a CD across to the centers to view it, because if you attend the teleconferencing, ask the questions, it will be for your benefit, and it will make things more interesting for all of us, because it becomes a virtual classroom interacting. So I would request that in future our learners are more serious about listening to and watching this teleconferencing and interacting with the experts. Thank you very much, and see you again. We will have one more teleconferencing in the month of April, probably 26, 27. We'll let you know the dates. Thank you.